All right. I'd like to welcome everybody to our November 2025 installment of the Rural Health Association of Utah's Rural Resource Webinar Series. This monthly webinar series highlights practical tools and programs that rural healthcare professionals across Utah may not be aware of or may not be tapping into. Our goal is to strengthen the rural healthcare system and outcomes by increasing utilization of resources and awareness as well. You can find all of the session recordings from our series on our website, rau.org/RHAU-webinar-series. We've been building over the year a comprehensive on-demand library tailored to the needs of rural Utah there, and there's lots of great resources you can go view on demand. We deeply appreciate all of our participants and presenters today and all those who view this online. It's your participation and support that makes this possible, and we'd also like to thank the Intermountain Health Foundation for their generous support as well to help make this series possible. Our agenda for today is as follows. Oh, sorry, skipped too far. We have two speakers today. We're going to hear from Sandra, and I've got to make sure I'm pronouncing your last name correctly, Sandra. Is it
Atari.
Akari? So Sandra Akari from Bear River Mental Health up in Logan, who's going to be speaking about maternal mental health, which is a really important topic. We also have joining us from Molina Health, Vanessa Coleman and Dean Frazier, who will speak a little bit about the work that Molina Health is doing in the communities. Great information there as well. I'm really excited to highlight what Dean and Vanessa do so people understand that Molina does more than just offer health insurance. They're out in the community supporting as well. Each presenter will have about 20 minutes, and then there'll be 5 minutes for Q&A following their presentation. So I'm going to go ahead and introduce Sandra. Sandra is a maternal mental health liaison at Bear River Mental Health, where she gets to support the wonderful communities of Cache, Box Elder, and Riche counties. For the past 5 years, she has been working as a full spectrum doula, providing heartfelt physical and emotional support to parents as they navigate the beautiful adventures of parenthood. With over 15 years of experience in the healthcare field, she has gained a wealth of insight into maternal and mental health. She genuinely loves what she does, and she lives in the lovely town of Logan, Utah, where she shares her life with her family and her playful rescue dog, Jackson. Uh, they love exploring the beautiful trails and parks around the area, and in her downtime, she enjoys delving into fun coloring books, experimenting with new and exciting recipes in the kitchen, and scouring thrift shops for unique finds. Every day, she aims to create a sense of joy and balance in her life while passionately supporting families in her community. And Sandra says it's a joy to make a difference. Sandra, the time's now yours. We'll go until about 12:20, 12:25, and then do your Q&A.
Thank you so much for the introductions, and thank you all for being here live and wanting to get more information in regards to maternal mental health. This is something that I'm passionate about because I have lived experience. I have a 12-year-old. Well, no, 13. She turned 13 yesterday. Year old, and so I have lived experience with dealing with postpartum, and that eager and drive to get more resources, more support is why I delved into being a full spectrum doula and having my own business tailored towards that realm of postpartum as well. So I started my role here at Bear River Mental Health about a year ago. It makes a year this month, because of a goal, because of a need. So it's between me and another colleague in Utah County named Cami. We are the only two statewide who are maternal mental health liaisons. So I feel very privileged and honored that I am in this unique role in serving families in my community as well. So, like I stated, it is part of a pilot program. It's a 3-year pilot program. We're on year 2 now. And I hope to expand and continue the work, but yeah, because of the need. And so Utah County being the first in regards to high birth rates, with Bear River being second highest in birth rates. So because there's such an increase in birth rates, this is how the pilot program came into fruition. And our goal is to improve access to evidence-based information, intervention and treatment if needed in regards to parents, in regards to folks who have just had a baby, right? In navigating. Um, and so, yeah, our goal is to normalize the fact that, having a baby is wonderful, but if you need resources, if you need certain services, we're here readily available as well. So that's the goal. That is the model I'm trying to push in regards to my area. And I hope to one day as well to see other maternal mental health liaisons in other parts of the state as well, because two, to be honest with you, is not enough. We need one in every county, um, if more, right? Multiple in certain counties as well, because certain counties are bigger than others. So I hope to see that in the future. So when it comes to the perinatal period, that's the period in which I cater towards. It's from conception up until full year postpartum. So conception meaning people trying to conceive, people who are elected to do IVF, people who have natural spontaneous birth, up until after they give birth in 1 year. So that those are the demographic of people that I serve. I also help people who have gone through loss and miscarriage, people who are adopting as well too, because they too can go through some maternal mental health disorders as well. So I have a wide gamut as to the demographic of people that I serve, depending on the situation. So, fun facts, I like um, throwing those out there. Half of the Utah women diagnosed with perinatal mental health have never experienced mental health in their life. So, because of the onset of pregnancy, they have experienced mental health illness, which is very new to them because um, one, they're pregnant and they're going to have a baby. And two, they're experiencing something that they never experienced. So, and because in regards to maternal mental health, it's not something that is really, I feel like it's talked about. We're getting better, but I feel like it's not talked about. Some of these people, in regards to my demographic, may not know where to go to in order to get resources that they need in regards to mental health. And then the second fun fact is accidental drug overdose and suicide are the top leading cause of death within the Utah women in the perinatal period as well too, which is alarming. So there's different conditions that this demographic can face, and demographic meaning perinatal people, pregnant people, postpartum people, people trying to conceive. They may experience something called baby blues. And generally speaking, baby blues last up until 2 weeks after giving birth. So up to 85% of women experience this condition. And what it entails is emotional sensitivity. They may be crying a lot, feeling overwhelmed, and none of this at their fault, right? They are dealing with hormones as well, fluctuation in hormones. So some of these things is to be expected. But if baby blues or this condition doesn't um, clear up or doesn't get better after 2 to 4 weeks of giving birth, then it may be something else. It may be another condition. And so that is something that they would have to let their healthcare provider know. I'm happy to know too that a lot of providers are doing the Edinburgh screening, which will be able to let the provider, let the parent know how they're doing. And the Edinburgh, I'll go into more details about it, but it consists of 10 questions. And generally speaking, the provider is supposed to score the the survey and be able to discuss it with the parents as well. And this is not a screening that is just one and done. It's a screening that should be done periodically throughout the pregnancy and postpartum, because things do come up. And so the goal is to be able to catch and give resources or give treatment if need be. So the other conditions that I said may manifest after baby blues can be depression. Um, More than 14% of new moms experience it. Um, Signs and symptoms of it is lack of sleep or changes of sleep, appetite, lack of appetite, energy may be down, may not feel motivated, may lack concentration, um, lack of self care, lack of interest as well to the baby. Other conditions, anxiety disorder as well. 16% of new mothers experience anxiety, feeling stressed or worried, shortness of breath, intrusive thoughts. And one thing I want to highlight is some of these signs and symptoms may overlap with each other, meaning some of the signs and symptoms of depression may also be the same as anxiety. It's up to the healthcare provider to be able to pinpoint which condition is this parent experiencing, and also to be able to give them resources or treatment, when these issues arise. So, but the main point, the main focus is to be able to screen periodically so that, if anything arises, then they could get treatment right away, and it's not something that is missed as well. So the next disorder is post-traumatic stress disorder. 14% of parents experience this. And also, when I talk about parents, parents can be the mom and the dad. So they also can experience things as well. So not just the mom. And again, symptoms include lack of self-care, lack of interest to the baby, intrusive thoughts as well, kind of similar with the anxiety and the depression. OCD, 4% experience OCD. So compulsive behaviors in response to intrusive thoughts, or attempt to make thoughts stop or go away, disturbing, repetitive, intrusive thoughts as well, harm for the self or the baby. So these are signs and symptoms. Next one is bipolar disorder. So 3% of parents experience bipolar disorder in the perinatal period. Um, and also to know, people who experience bipolar disorder are extremely vulnerable to reoccurrence during pregnancy and have an increased risk of psychosis as well. Um, So, in regards to miscarriage, pregnancy, and loss, 10 to 25% of all pregnancies end in miscarriage under 35 for the state of Utah. 1 to 3% of women experience 2 or more pregnancy losses. 1 in 8 or 12% of couples have trouble getting pregnant. And there are a range of complex connections between mental health and infertility. And I'm a firm believer of that. I see it with my own two eyes as well too. Couples who are struggling, they also experience mental health conditions because of this. Nearly 20% of women who experience a miscarriage become symptomatic for depression and anxiety. In a majority of those affected, symptoms persist for 1 to 3 years, impacting quality of life and subsequent pregnancy. Again, another situation in which I've seen with my own two eyes that it does impact. So this data is not just data, it directly impacts families here in Utah. So fathers and partners, I mentioned this earlier that yes, they also go through things as well too. 1 in 10 fathers get paternal postpartum depression. Up to 60% of fathers suffer from anxiety disorder during the perinatal period as well. So our goal in regards to this pilot program is to improve access to maternal mental health intervention, normalize it, and strengthen community referral pathways, which is what I'm doing today. I'm presenting to all of you all to get the word out that, maternal mental health is something that's impacting our community. Also providing seamless transition and care for people who are at risk for or currently have a behavioral health condition in the perinatal and postpartum period. So my role, I receive referrals from various community organizations, i.e. home visiting. I'm in Logan, so we have USU here. So I work a lot with the college students as well and the staff, our local hospital as well, various organizations, WIC as well, the health department. So I let providers know about the referrals. So providers, meaning our clinicians here at Bear River Mental Health. Um, and also too, in regards to insurances, we do take Medicaid, we do take certain insurances as well as there's grant funding. So we have a vast array of funding options for these people because not everybody has Medicaid, in the state of Utah. So there's different ways in which they can still get services from us. And also, too, it's very important for in regards to wraparound services as well. So it's not that the community organization, i.e. the health department or WIC, just refers and that's that. I like to make sure that, yes, the referral that they gave to us came in, are receiving services, they're doing well, giving them an update as well too, because that does matter. So the screening, like I mentioned before, is abbreviated EPDS, but it's called the Edinburgh Postnatal Depression Scale. And there's suggestions as to when it should be done. So definitely during their first visit, if you meet with them, while they're pregnant, one time during each trimester of pregnancy, 1 to 2 days after giving birth, 2 and 6 weeks postpartum, and up to 12 months postpartum. So again, you see that the screening is not something that's one and done. It's done periodically because things come up, things change, and so we're able to pinpoint, if things change, what are treatments, what are resources that we can give to the family. And so this just goes more into details about the screening. I already touched on this, but it's a screening that consists of 10 uh, questions. Anything 10 or greater could mean that the person is experiencing depression or anxiety. And also, just so you know, the Edinburgh is available in other languages as well too. Spanish, Portuguese are two languages that I have translated as well too for because of our demographic, because of the people that we serve here in the Bear River region. And so this is just how that Edinburgh looks like. And according to the scale, according to the score, then we will know how to proceed in regards to, treatment and resources for the clients. So risk factors, what are risk factors that directly impact this demographic of people, perinatal people? So anybody who's experienced depression before is at a higher risk of having maternal mental health disorders, history of trauma, financial troubles, history of substance abuse as well. So there's a plethora of risk factors that people should be aware of. And then sunshine is something that we utilize here just as like a gentle reminder for parents, because sometimes you forget, in regards to sleep and, support. No, so it goes sleep, understanding, nutrition, support, humor, information, nutrition, and exercise. And so I like to give this to them as a gentle reminder. And also, too, in regards to this demographic, they have their own maternal mental health hotline. I'm sure you all are aware of 988, but this specific demographic has their own line through HRSA. And so it's 24 hours, 7 days a week. They have multiple language being spoke, and it's confidential. So this is a resource that I also like to share with my parents here. Here's my contact information as well, if anyone needs to connect with me. And yeah, any questions?
Just a reminder that these slides will be posted online. So if you are watching the recording and missed grabbing contact information for Sandra, it'll be there available online. And then I do want to put a plug in as well. Sandra will be attending next week at our Rural Health Association of Utah annual conference. Anna West, who's on the call, has helped put together a workshop on maternal health in rural Utah, building on a report that was done between Anna's office and Kempsey Gardner about maternal health in rural Utah. And we're really excited to put as many stakeholders as we can together in that room next week to see where we go from here with the information that we've gathered, the resources that we have in order to start closing some of the gaps that we know we have. Anna, is there anything you want to add?
Nothing to add, but thank you so much for doing this. This has been really good, and I'm excited to see you in person next week. And if you do want to come and don't have an invite, let us know. You can reach me or Casey. Probably everyone has Casey's email. Yeah. And then just forward it on over. We'll get you involved.
Yeah. And then this will hopefully just be a kickoff point for more work to try to close the gaps that we know we have and improve mental health resources in rural Utah. And would love to see what Sandra and her colleague does expand out to all the areas in rural Utah. Such important work.
Thank you again.
Do we have any other questions? Okay. Thank you, Sandra, again for presenting these resources. This is very, very helpful, very educational, very evidence-oriented, and a great presentation. We're actually going to move now to our second presenters. We're being joined by Vanessa Coleman and Dean Frazier from Molina Health. I do have your slides, Vanessa. I figured out I can share, or I can put them in presenter mode. I couldn't add them to my PowerPoint because it wasn't giving me access to download it. But I can share it like this. But if you could get me a PDF afterwards that I can include in the PDF that goes online, that would be great. But Vanessa has spent more than 2 decades working with Molina Health in sales, and also owning 2 small businesses and serving in several nonprofit organizations. And today she is a proud part of Molina Healthcare, where they focus on improving the quality of life for people in 22 states by providing access to healthcare, transportation, no-cost gym memberships, and nutritious food allowances that do not affect their state-funded benefits. They also have the Molina Cares Accord Foundation that has provided many grants, volunteer opportunities, and sponsorships locally. She is passionate about making a difference in the underserved communities, and when she's not working, she loves exploring Utah's amazing natural landscapes. And Vanessa is being joined by Dean Frazier, who works with Molina Health in the Northwest Region as a Northwest Region Community Engagement Specialist. And he helps provide access to healthcare and services to underserved communities in multiple states through collaborations and partnerships with nonprofits like the Rural Health Association of Utah, service providers, and local coalitions. We are very excited to have Dean and Vanessa on the call today. I will hand it off to you guys. I'll move the slides for you through when you're ready. If I miss it, and don't advance it when you're ready, just let me know and we'll keep it moving. But you have until 12:50.
Awesome. Well, thank you so much, Casey. I just want to speak for both Dean and I when I say we are absolutely grateful for the opportunity to be here and to present to all of you today. So we'll just go ahead and get started here on slide 1. So I think it's up right here. So many of you may be asking, who is Molina Healthcare? And so we'll just kind of go over the basics and run through it. And I'll take some questions at the end. So Molina provides managed healthcare services under Medicaid, Marketplace, and Medicare programs. We've been serving people for over 40 years, and we serve approximately 5.6 million members across 22 states. At Molina, we believe that everyone has the right to accessible healthcare and to live healthy lives. Our mission is to erase inequities in the way different populations are treated and served by providing high quality healthcare options. And then next slide. Yep, perfect. So what is a dual eligible special needs plan? These are typically referred to as a DSNP. This is a Medicare Advantage plan that is designed for individuals who qualify for both Medicare and Medicaid. These plans bring together a person's state Medicaid benefits and the federal Medicare benefit under one coordinated program. So this is what Molina does best in the Medicare space. This is really, really where we thrive, is providing a lot of additional benefits that you can get without combining and coordinating the programs. So what does that do? By combining both sources of coverage, a DSNP member allows the insurance providers to deliver enhanced services and supports that go beyond what either program can offer on its own. For members, this integration means, I think we're still on this.
That is clicking.
That one, yep.
I didn't click anything. I'm not sure why it advanced. I apologize.
You're okay. For members, this integration means having one point of contact for all their health benefits, making it easier to navigate care, access resources, and stay engaged in managing their health. For our coalitions and partners, a DSNP represents an opportunity to improve outcomes for vulnerable populations, reduce fragmentation in care, and strengthen community health supports through collaboration and aligned goals. Next slide. I should have put that on there for you. My apologies.
This is skipping on me, so if it jumps forward, I apologize, I will fix it. But when I click once, it jumps to 2 slides.
Okay, nope, this is the right slide. We're good. So did you know that 4 out of 5 people on Medicare have at least one long-term health problem? This is huge. Our special supplemental benefits support those who are chronically ill and can provide additional monthly financial resources. We apply funds to a preloaded debit card every month for members to purchase healthy foods. We also offer prepared meals that can be delivered straight to their home. For all our Medicare members, no matter their health status, our plan includes additional benefits such as the no-cost gym membership, preventative and comprehensive dental services, vision and hearing benefits that include no-cost hearing aids every 2 years, and a monthly allowance that members can choose to use on over-the-counter products or for public transportation. With Molina, we know that mental health is just as important as the physical aspects. So if a member chooses to use their transportation to visit a friend, go to the movie, or even the park, it is perfectly okay with us. In addition to this allowance, Molina also provides non-emergency medical transportation at no cost, and they just need to schedule that in advance. The best part out of all of these benefits is none of them affect a person's state-assisted programs that they're already qualifying for, and it doesn't impact their income or gross. So that's really huge to know. Next slide. So when can someone sign up? People can change their benefits during the Medicare enrollment periods. Currently, we are in the annual election period, and this started on October 15th. It runs through December 7th. This is when anybody with Medicare can review and change their plan or provider. For 2026, members will have one additional opportunity to make changes between January 1st and March 31st. Outside of these windows, plan changes are only allowed in the state of Utah if a person experiences a major life qualifying event. So these dates are very, very important to be aware of. And it's also important that every single Medicare member out there reviews their plan every single year, as benefits and coverage details change annually. One of the things that I love most about our plan is there is no monthly premium. For those with full Medicaid, there are no copays for healthcare, hospital stays, ER visits, surgeries, and so much more. I absolutely love how we can come in and really help with this demographic as much as we can. So next slide. So established by Molina Healthcare Incorporated is the Molina Cares Accord Foundation. We are very proud of our foundation. It oversees a community investment platform created to improve the health and well-being of disadvantaged populations. We do this by funding meaningful, measurable, innovative programs and solutions that improve health, life, and living where it matters the most, which is in our local communities. Everyone has the right to healthy, vibrant life, and we're here to erase disparities that keep people from achieving their true potential. It's important to note that these donations were made on behalf of the Molina Cares Foundation and not Molina Healthcare. So far in 2025, the foundation provided a grant in the amount of $25,000 to Operation Warm, which resulted in 144 pairs of shoes and socks donated to the Salvation Army in St. George for their back-to-school bash. This month, they're also donating 400 coats that will be distributed to homeless individuals that attend the resource fair in Salt Lake City. In September, a $25,000 grant was awarded to Tabitha's Way to provide holiday meal kits for both Thanksgiving and Christmas to families in need. And then the Molina Cares Accord Foundation also supports volunteer hours from Molina Healthcare employees for several events throughout the year. Some of these events so far this year include the Children's Day with Elevate for Central Hispano, the Safe Kids Fair in Ogden, the Molina Valley Behavioral Barbecue, the Meet the Candidates Barbecue, the Utah Open Golf Tournament with the Special Olympics of Utah, the Homeless Resource Fair with Operation for Warm Coats, Tabitha's Way for the holiday food giveaway, and then we're also doing the Festival of Trees, which is one of my personal favorites. So super exciting. Next slide. This year, Molina and Valley Behavioral Health co-sponsored a barbecue community resource event for unhoused members of the community, where all were welcomed and able to receive resources from over 30 community-based organizations. We also partnered with the Boog Bus to provide mammograms to those without insurance. And that was also down in St. George this year. Our Utah field teams host several events every single month and are always looking to expand our reach to make a meaningful difference. Dean and I have dedicated hours upon hours and are excited to share. So far this year, Molina has partnered with organizations such as the Iron County Care and Share, USARA, UHPP Health and Heritage Fair, Crossroads Urban Center, The In-Between, Sacred Circle, Tabitha's Way, Salvation Army. There are so many great corporations and partnerships that we've made out there. There's several others that we co-host events and community projects, bringing valuable services to our communities. We absolutely love doing that. Next slide. So finally, Casey asked me to share exactly what it is that Dean and I do. We get this question all of the time, and I can only guess that he means when we're not being called by Utah's landscape and going hiking in our free time. That we are just out there. Dean and I absolutely value working with organizations across Utah to bring communities together for the greater good. Our goal is to foster a safe place for everyone to discuss what their community needs the most and work with people like you to make it happen. We share Molina's passion to help all persons, regardless of their situation, gain access to basic needs, quality healthcare, while highlighting the many resources available in our communities. It's amazing what can be pulled together when you know where to go and who to get involved. Recently, through collaborating resources, Dean and I have had the pleasure of supporting Rose Park Elementary with 325 shoes, 125 gifts for students to give their moms on Mother's Day, brought in numerous resources directly to the school, including no-cost vaccines with the Salt Lake Health Department, supported numerous holiday events and countless hours to help this local community. I can definitely say it's one of the things to enjoy going to work, and it's quite another to absolutely love what you do and do what you love. It's only possible when we can make a meaningful connection like these and do it together. And then last slide, we're finally there, Casey. So exciting. So thanks for allowing Molina Healthcare to join you guys today and for allowing us the time to share with you a bit about what we do. Our goal is, if you know of an area that we can support, offer help, or even plan a resource fair, we encourage you to reach out and just open it up for any questions. Thanks, Bonnie.
Yeah, I think this is just a great example that, Molina Health is doing a lot to keep our communities strong. And I think this is programming people may not be aware of, which fits exactly the type of thing we look for this webinar series, so people know the kind of work and effort Molina's putting into serving their community. And I appreciate what Vanessa and Dean do. It makes a huge difference. Caring for people takes a lot of different approaches and different programs, and this type of activities that you guys organize shows Molina really cares about the whole person that they're serving.
Thank you.
Yeah.
Absolutely.
Do you have any other questions? I'll go back these slides will be posted, so contact information will be there. And it looks like we'll be able to wrap up just a little bit early today, which is fine. Just a couple notes as we close. Our next session is scheduled for December 4th of 2025. This will be our last session of the year. We have a couple presenters coming from Utah DHHS from a couple different offices for that session. And we'll be presenting case management certification resources and monthly training for case managers, as well as free and confidential evidence-based tobacco cessation services that are available in Utah. Very excited for that session. You can register for that session on our website at rhau.org/webinar-series. rhau.webinar-series. That's also where you'll find all of the recordings and the slides from today. And if you'd like to, you can also just scan the QR code there to register for that December session as well. We really appreciate everybody who attended today and for your support. We will be taking a break with the webinar series following the December session, hoping to return in February or March of 2026. We'll put information out about that. But we hope you have a wonderful rest of your day. We hope to see as many people as possible next week at the RHAU conference. Dean and Vanessa will be there as well. Molina will have a table at the conference. If you'd like to come chat with Molina, they will be there. And then if you have any other questions, just let us know. But we appreciate everybody's support and participation today.
Thank you so much.
Thanks for having us.
Yeah.